I'm Dr Bryan Sheinman. I'm a consultant chest physician and we deal with disorders of the lungs and airways. When we think of persistent cough, we are thinking of cough which essentially has no X-ray or CT changes associated with it. And there are a number of well-recognized causes of this, although many patients we do not find a specific cause. The commoner causes are gastrointestinal reflux, which may be either acidic or non-acidic, a thing called cough variant asthma, which to all intents and purposes is asthma without wheeze or shortness of breath, but these patients cough and they're very gratifying to treat because they get better very quickly. Postnasal drip, which many patients experience, refers to drip down the back of the throat. And it can have a number of causes, for example, allergic rhinitis, sinusitis, and so forth. And there is another group of causes revolving around a diagnosis called eosinophilic bronchitis, which looks a little bit like asthma under the microscope, but actually behaves rather differently to asthma, but does cause persistent cough, and again is very gratifying to treat. Outside of these things, we do have a group of patients who we cannot specify a cause for, and we refer to them as chronic refractory cough, but we do have strategies for dealing with it. The reason for choosing a clinic dedicated to the management and treatment of persistent cough is because it has been shown by a number of studies over the last few years that the best results are obtained when the staff are actually dedicated to this particular syndrome. Furthermore, it requires special organisation because we may require the help of laryngologists, who are ENT specialists, of speech and language therapists, although it's nothing to do with speech and language. These ladies generally are excellent at managing disorders of the vocal cords and ensuring adequate hydration. We may need the help of a gastroenterologist. We may need a upper gastrointestinal physiologist. And indeed sometimes an upper GI gastric surgeon. So a combined approach and easy accessibility to a variety of colleagues is quite important. What can a patient expect when they come to see us in the persistent cough clinic? Well, most important is a thorough clinical history, because there's a saying in medicine that the clues to the diagnosis are in the history, and that certainly is true for persistent cough. We use a series of research-validated questionnaires which help point us in the right direction. We use scores associated with these questionnaires, and we also examine the patient thoroughly. And dependent on what we have found in both those elements, we will proceed to a chest X-ray if a patient hasn't already had one, although of course most people who've had a cough for a long time have had a chest X-ray, although it needs to be a recent one, possibly a CT scan. And then we may proceed to trials of treatment, because many of the tests are not 100% reliable, and we infer by giving a trial of treatment that if the treatment for a particular condition works, then that's what the condition was. It sounds slightly about face, but it is nevertheless the case, and we do a lot of that. We may also do lung function tests, which mean breathing in and out of various pieces of apparatus, all of which is quite simple. And we generally are able to come to a conclusion within 1 or 2 consultations. But the management of persistent cough is not necessarily a one-hit job, and it may take several times and several different kinds of tests or trials of treatment before we're able to reach a firm conclusion.